And during this webinar, we'll be going over the COVID-19 Emergency Financial Assistance application. Oh, okay. So the AIDS Foundation of Chicago has recently received funding from the Chicago Department of Public Health for low-income residents who reside in the following counties: Cook, DeKalb, DuPage, Grundy, Kane, Kendall, Lake, McHenry, and Will. The purpose of this assistance is to provide support to individuals and families who are living with and vulnerable for HIV by addressing any COVID-specific emergencies, COVID-19 specific emergencies, excuse me, and continuing to provide support for these individuals. The AFC COVID-19 Emergency Financial Assistance Program will offer a one-time payment to support individuals during the COVID-19 crisis. Assistance can be split between multiple categories, but the total assistance amount can be no more than $1,500 per household through February the 28th of 2021. Eligibility criteria will include all households that are applying for assistance must be able to document a temporary financial crisis that's related to the COVID-19 outbreak. Some examples of documentation of a crisis is a temporary or a permanent loss of employment due to COVID-19 related closings. So a letter of furlough, a letter of termination, a letter of a hold in a position because of COVID-19 from the employer to the employee, who in this case would be the applicant for assistance. Additionally, any unexpected expenses or costs that are related to the COVID-19 outbreak can be covered. All applications need, so we'll go over now some of the documentation that is going to be needed for all of the applications. So regardless of what category of assistance someone is applying for, all of the applications need to have this documentation. So temporary financial crisis that's supporting a documentation, or sorry, temporary financial crisis supporting documentation that's related to COVID-19. Again, so a letter or other notification from an employer of a shutdown due to COVID-19. So a termination letter, proof of self-employment, loss of income. So if someone is self-employed or they run their own business, they need to attest, they need to submit a letter that says that because of COVID-19, they are not making enough money to support themselves. And then they will need to submit something like a 501c3 letter that shows their company, or whatever sort of incorporation letter that shows that they are the owner of this place of employment. All applications also need a copy of a client state issue ID or any other government issued ID. All applications will also need proof of one or the other. So proof of HIV status. This includes an HIV test result with the client's name on it, a detectable viral load, or a medical attestation. That basically means a letter from a doctor or a medical eligibility form if they have one. It doesn't need to be recent. Again, because it's proof of HIV, it can be something that they've had in the bottom of their underwear drawer for the last 10 years. As long as it has their HIV diagnosis and their name, it's acceptable. If labs indicate an undetectable viral load, additional proof may be requested. So please keep in mind that if someone has a non-detectable viral load, that does not serve as proof of HIV. They still need another document that actually shows that they have HIV. For example, a detectable viral load. If the client is registered in our Provide database, which is our Ryan White client database, and in their record in Provide, there is existing HIV proof, this documentation requirement is waived. I strongly encourage staff at the Center on Halsted, as you're completing applications with individuals, that you call AFC as you're collecting this information. If for whatever reason getting proof of HIV might be difficult because someone's medical office isn't responding, et cetera, to call AFC and check if someone is in Provide and if we already have that proof of HIV infection in Provide. And then this proof of documentation is waived if we already have it in Provide. Additionally, no, not additionally, or so in place of, if someone is not applying because they're HIV positive, but they're applying because they're utilizing PrEP, we need proof of PrEP utilization. Again, this is a letter of attestation from a medical provider, so a prescription, a letter from the medical provider that this individual is on PrEP, or a photo or a scan of a medication bottle. And the medication bottle will need the applicant's name. It will need to be a prescription for Truvada or Descovy. And it will need to be submitted to AFC. Okay. So I'll take there are additional stuff, I just skipped ahead, but I will now take any questions from any of the attendees that have questions. Please unmute yourself and then feel free to ask your question. If there's background noise, I'm going to ask you to mute yourself after you've asked your question. Any questions so far?
Yes, I have a question. This is Javier here.
Hi, Javier.
Hi, Prep Navigator at Center on Halsted. Did I get that correctly, that unless they are detectable, it will not count? This will not be a service for them?
No, it was only about the supporting documentation. So if someone is living with HIV, they will need to submit proof that they're a person living with HIV. So what that means is that if you go to your medical provider and they give you as proof of HIV a viral load test, you're either one of two things, right? You're either detectable or you're undetectable. If you have an undetectable viral load, that doesn't prove that you have HIV.
Right.
Right?
Okay.
So
it would have to be the first. It can't be a recent one that says that they are now undetectable. It has to be one that says
that they were undetectable, right? It could be a recent one that says that they're detectable, but as proof of HIV diagnosis, it has to be a detectable viral load. Otherwise, it doesn't count as proof of HIV diagnosis for viral load.
Okay. Thank you.
Okay. Sure.
So, Romano, just to clarify, I've had some clients in which their viral loads might show as undetectable, but then it has a note on there from the medical provider showing that they're being treated for HIV. Would that be sufficient?
Yes. So you're talking about like the test orders that come out, or like a printout from the
Yeah. And sometimes they just said client being treated for HIV, and then here's all the ordered labs and their results. But the viral load might show less than 20, but then because it has that note on there that says this client is being treated for HIV, would that be sufficient? Because technically it's not like hand signed by the physician, but usually those printouts are like time stamped. So is that enough?
Yeah, that would be sufficient. Also,
Okay.
sometimes when you're checking out of the doctor's office and they give you like a what you got during this visit, there are sometimes diagnosis codes that are put on that form that show what the individual was treated for. Those would count as well if the diagnosis code is HIV infection.
Oh, okay. So like the walkout summaries is what you're talking about.
Right. Sometimes those have your like what you're being treated for, right? And so if
Yeah,
that
your
has
ailment.
HIV listed on there, that would count as proof of HIV.
Oh, okay, perfect. Thank you.
Cool. Any other questions? Okay. Let's move on. So now we're going to talk a little bit about the specific categories of assistance and the documentation that's going to be required for those kinds of assistance. So the first is going to be utility assistance. So the utility assistance, we will be accepting copies, a copy or copies of current or past due utility bills. AFC will cover electric, gas, water, internet, and cell phone service. We can also, we're still figuring out the details of it, but we can also add minutes to individuals who have cell phones with the fixed number of minutes to be able to increase their minutes for whatever purpose, but we can add minutes to cell phones as well. For utility assistance, the bill must be in the name of the client in order for the individual to receive the service. For rental assistance, applications must have a current lease or a current rental agreement form. For folks who haven't done emergency financial assistance applications before, there's a template of a rental agreement form that's included in the material section. So if someone is requesting rental assistance and they don't have a lease currently or a rental agreement with their landlord, they can use this template as a way to document their monthly rental expense. So again, a lease or a current rental agreement form or a mortgage payment statement. This is either an electronic statement that shows how much someone pays monthly for their mortgage, or a payment coupon from their payment coupon book. Some mortgages give you payment coupon books and you tear one off every month. If they want to just show that to demonstrate who it has to be paid to and how much their monthly amount is, that could be submitted for that assistance. Again, note that the AFC rental agreement form is only completed if the applicant does not currently have an actual lease with their landlord. So the first path to go down is to ask the individual if they currently have a rental agreement with their landlord or a lease. And then if they do, actually get a physical copy of that document to submit with the application. If someone is requesting rental assistance, and this is only if someone is requesting rental assistance, we will need additional information from the landlord. Because of the IRS requirement that any payments made to landlords that are rent are considered rental income, we have to notify the IRS about that. So because of that requirement, we need proof of ownership from the landlord. So we need a property tax statement or a mortgage statement or so some document that shows that the individual to whom we are making the rental payment to is actually the owner of the building. We need a landlord federal W-9 and EIN verification letter. If it's not a management company, the landlord must submit a legible copy of their social security card. Again, because we're required to report this to the IRS, these are requirements for any rental assistance. Right, and so with that, I will, actually let me do the last category and then I'll take questions after that. Releases and authorizations that are required. So assigned client's rights, responsibilities, and grievance form, and assigned AFC consent to release information. Both of these documents are included in the, or these actually 3 documents, and they're all included under the materials section. So make sure that you download them because they will require a client's signature. I think I skipped a section. I did not. I don't know why I don't have it. But there's also emergency food assistance. The emergency food assistance will be a $200 Jewel gift card. It is to cover food, it's to cover hygiene supplies, it's to cover over-the-counter medications, and there's no documentation required for that. So anyone who applies doesn't need to require additional documentation. They just need to check that they are requesting the $200 emergency food voucher assistance, and they can receive that. So with that, I will open it up to any questions about the different categories and the required documentation in the categories.
So this is Jill.
Mm-hmm.
This might be, you may be hitting on this. With all this paperwork and people not being able to print things out, I'm not sure how that's going to be implemented.
Yeah. So unfortunately, yeah, I mean, I think unfortunately because we're able to pay, not necessarily like, because we're able to pay for things that aren't necessarily emergencies, like we can pay for the April ComEd bill. We have some time potentially where we can mail documents out to individuals and have them sign them, text them, and text them back to us. Or if they have scanners, yeah, a photograph of a signed document would work.
And if that's the case, you know, many of these are multiple pages. Do they only need to send the part that they signed?
So they only need to send the forms that require signatures. You'll see when we do the demo that all of the application portion of this is all filled out in CaseWorthy. So the only reason why you'd fill out, like for example, the application, it's uploaded as one of the materials primarily so that you get a sense of what kind of questions you're going to be asking. The goal is not that you're going to complete it on paper, though. The goal is that you're going to complete it in CaseWorthy. The only time you'd actually complete the application is if for whatever reason CaseWorthy isn't working, you have the client in front of you, and you don't have access to CaseWorthy, so it's totally an emergency backup. The goal is not to use the paper form of the application. The goal is to use CaseWorthy and to enter the application in CaseWorthy. So really the process is that you collect the documents from the individual first, and then you complete the application.
But again, just the form that they have to sign, the different forms, if they take a picture, they only need to take a picture of the page that they sign, not the entire document, right?
That's correct. So for example, if they're requesting just the emergency food assistance, they would need the documents that have to go in with all applications, right? So they would need to have a copy of their state ID. They would need to have a letter from their employer of their termination. They would need to take a photo of that on their phone. And they would need their either proof of HIV or proof of PrEP, sort of a picture of their PrEP bottle. And they would have to text those documents to the service provider or the person who's completing the application for the application itself.
So I think what we were going to do, because it had to be to a agency-owned phone.
Yes.
Is that we were going to have all the rapid responders tell the client to text it to the hotline cell phone, and Nicole has that, and then she would use the COH email and then email that picture to the rapid responder off of Center on Halsted email so they could collect it.
Right, and then you just put it in a shared folder or a shared drive that everyone has access to, and name them appropriately so that everyone knows sort of whose application is what. Right, and then people would have access to the actual documentation that's going to then be uploaded into CaseWorthy.
So we don't have a shared drive offsite.
Okay. So she can send them as email attachments to Center on Halsted staff. The biggest thing to remember is to make sure that after you've uploaded it into CaseWorthy, and you test it to make sure that it's there, that you purge them from any sort of temporary device that they might be stored on. So if you download it from your email and you put it on your desktop, for example, to be able to have the documents easy to access, you make sure that you just purge them off your desktop after you've done that. Similarly, for AFC staff who are completing applications, we will be using 2 staff's agency cell phones. They're going to be the cell phones for Jamaica Hicks and for Kayla Dillard. And so those 2 individuals will be receiving the documents via text, and then they'll be saving them in a shared drive that staff will have access to then upload the documents.
Okay, thank you.
Sure. Any other questions?
Yes, this is Zach Hudson. Can you hear me?
Hi, Zach. Yep, we hear you.
Right. Just in case a client can't get in touch with their employer at this time, would a letter from the Unemployment Benefits Agency work as well as a letter from the employer?
That's a great question. I'm inclined to say right now my preference is that we really try really hard to get a letter from the employer first. If we absolutely can't, then we can explore sort of other pieces of documentation. But I think in terms of the crisis itself, my preference is to get a letter from the employer that states that they had to let someone go. And my expectation, quite honestly, is that anyone who's had to let staff go is going to be available to help them get any sort of kind of financial assistance that they need. So right now, I'm going to say let's try really hard to focus on getting a letter from an employer. I know of a couple of instances of folks who were let go, and the day they were let go, their company actually gave them a letter. So that if they needed to, they could use that to apply for assistance. So I'm hoping that a lot of employers were as empathetic and were helpful with folks. So right now I'm going to say let's focus on getting the letter from the employer. If it becomes a challenge, then let's talk about backup documentation.
Roman, this is Lurisela. When it comes to letter, do you mean something specifically just on company letterhead, or can an email from the company letting you know of the furlough or layoff is it?
I would accept an email communication as a letter.
Roman, I had another question.
Sure.
What exactly does the language need to be in said letter? Because some places may not be the most formalized, like office settings. Like I have a client that's a mechanic that I'm applying today.
Mm-hmm.
Their boss might just write an email saying like blank is not working because of this crisis. Is that sufficient?
I would like, I mean, if it's an email and it's dated, that gives you an indication of the date that it started. I mean, ideally, it sort of has a date on it. It has who is sending it, and it talks about the individual no longer working. So as long as all of those pieces are sort of in that communication, I would accept that.
Okay.
So are there any other questions before I sort of move on and talk a bit about the process? Okay, cool. So as we speak, AFC has begun the process of actually sort of notifying the community, beginning with service providers and then slowly expanding the communication about this emergency assistance application that's available to the community. And so all of the communication.
Is it starting now? When does this start?
This starts tomorrow.
Tomorrow. Okay, thank you.
So tomorrow officially, folks can call in and rapid response team members and AFC staff that are completing applications can start to collect the documentations necessary for completing applications. So communications are going to go out. The principal method of communication currently that we're giving out is the hub number. So individuals will be calling the hub number. Please keep me up to date as to whether there are any issues, whether there are any challenges, what volume looks like. If it starts to sort of become overwhelming, let me know and we can get additional support to the center to handle any sort of volume issues or concerns that happen. But basically, once the calls start to come in and individuals begin to request this assistance, the rapid response team will help to identify the crisis and begin to review client eligibility. So basically going through the eligibility for the different programs and walking through the necessary supporting documentation. They will then work with the individual to obtain the required documentation, everything that's necessary, making sure that if they're taking photographs, that the photographs are legible, that you can see signatures clearly, that you can read the pill bottle clearly. And then once all of the necessary documentation is obtained, then the rapid response or AFC staff will complete the EFA application in CaseWorthy. And we'll be doing a demo of that in about 2 minutes. That's how that's going to happen. Once they submit the EFA application and all of the supporting documents into CaseWorthy, someone at AFC will review the application. You will be notified as the person who completed the application within 72 hours what the status is of the different requests. So you might get an application, right? And you submit a request for rent, an electric bill, and $200 in food. And because for whatever reasons, there's something funky with the documentation, you might get approved for the ComEd bill and the food. And for whatever reason, the rent might not be approved. You'll be notified of that within 72 hours, and then you can talk to the participant. After that, you have 14 days to resubmit any documentation on any outstanding portions of that request. So you have some time to talk to the individual, see if they want to try to submit other documentation or get other documentation that might be accepted. So again, the service provider, you'll get a determination within 3 business days that you submit the application. If it's missing or it has incorrect information, you've got 14 days to submit correct documents. Again, because of the non-emergent nature of the utility stuff, because we're not requesting sort of cutoff notices or anything like that, we're going to wait until, if you decide you want to wait and submit more documentation for one of the requests that was denied, we'll hold the application until such time as you submit that documentation. But it really requires a conversation, right, between you and the individual requesting the assistance as to whether you want to try to get additional documentation and submit a more complete application later, or if you just want to receive the assistance that was approved. And this is the number, right? 1-844-HUB-4040. This is where all of the requests are going to come through. So all of this information, this communication is going out now, and hopefully we will begin to get the requests beginning tomorrow. I'll take a quick break here for questions, and then I will switch it over to Joel. Any questions?
Hey, Ramon, this is Bash. How do you want folks to handle if there are requests that clients have that are not pointed out on the application right now? So it's not utility, it's not rent, it's not food vouchers, but it's another type of expense they're asking for. How do you want to handle that? Should those just be sent to you for consultation?
I would, yeah. If there's for whatever reason, if there is an expense that someone had that's COVID related, consult with me, contact me. For everyone, in case you don't already have it, my number is 312-334-0960. We will I will work with you to determine whether it's an allowable expense or not.
Roman
Hi,
will be.
this is Javier, Prep Navigator. I had a question.
Mm-hmm.
I know for the use of Prep, you all want proof, so like a picture or a letter. If they, for whatever reason, if I'm speaking to people who might have gotten nervous and did not pick up a prescription for, let's say, the month of April, but like, is it all right if that proof is for the month of March? Is there like a limit to what current means? If that
Yeah.
makes sense.
Excuse me.
Let's see.
It does not have to be it does not have to be a bottle for the current month.
Okay.
So if what they have is February, they could submit it for they could submit a picture of their PrEP medication for February.
Ramon, if a client is HIV positive, if they sent me a picture of their HIV medication, would that work as well as the paperwork?
So for proof of HIV, we don't accept proof of picture photos of HIV medication with an individual's name on it. So we don't allow that. So for proof of HIV, it would need to be either a lab result or a letter from a medical provider. We typically haven't accepted a proof of a pill bottle or a picture of a pill bottle as proof of HIV. Any other questions?
Yeah, well, are we going to get a copy of these slides after the presentation?
The slides are available through the materials section of the webinar. So it's already, the copy of the slides is already up.
Okay, I'll have to see if I can figure out how to download that.
Okay.
Ramon, I downloaded the PDF that was in those materials, and it because it's a PowerPoint, it didn't actually save a lot of the content in the slides. Like
Oh,
the slides are just kind of blank.
Oh, that's no good.
Yeah.
I'll recreate it and I'll send it out to folks. Let me write a note to myself.
Yeah, I don't see a materials section where I could download the items.
It was in the
either.
original link that we used to sign up for the Citrix. It was in that original link.
Oh, okay,
You
so
might
it's
have
an
to
email. Okay.
You might have to re-register to access the material list, because that's what I had to do after I X'd out of that window.
Right. Also, for AFC staff that didn't receive the materials, I'll put everything into a folder in the special projects section of the T drive. Okay. So I'll put everything, including the presentation and stuff, into that folder as soon as the webinar concludes.
Okay.
Hi, Roman. This is Alma.
Hey, Alma. What's up?
Quick question. If people need to get proof of status and they cannot obtain from a case manager, can they call one of the care team, care coordinators, or someone on the care team to get something from Provide?
Yes. So if they indicate to you that they've received Ryan White services before, then you can, or DOOR services before, which is the home services waiver, AIDS Medicaid waiver program. You can contact someone at AFC, and we will get you the, we will check and provide for the HIV documentation. And if they have documentation because they've received services before, if they have that documentation and provide, then that sort of requirement becomes waived for that application. You don't need to get any proof of HIV because we've already got it in our database. So feel free to call anyone on the care team. For the Center on Halstead staff, you have a listing of AFC staff. Particularly Sheila, Jamaica, Angela, Lakeithia, and myself all have access to Provide, and we can all get you that information as needed. So feel free to give us a call. Okay,
sorry, this is Amy. I have a question.
Sure.
So what it's looking like is that there might be a bunch of calling back and forth, right? Because I got like actually like 4 calls about this yesterday.
Mm-hmm.
And so I think the majority of the people didn't really appreciate that they were going to need, all these different documents. So is this a matter of educating, these potential clients on what they're going to need before we even sit down and start the application process?
Definitely. I think a lot of this is going to be expectation setting, also resource sharing. I mean, there are other resources that are available as well. The city has a similar program that they've implemented, where you can go online and you can submit applications online for assistance with rental expenses, and their requirements aren't as stringent as these. And so, it's not only about like, well, for this application, these are the kinds of categories of assistance, and this is the kind of documentation we're going to need for these assistances. If this seems too stringent, if this seems like you're not going to be able to collect this documentation, here are potentially some other programs that might be able to help you, where you can go online and you can get assistance without having to meet those requirements. The biggest one, and I'll be honest, it's a barrier that we've talked about for years. Unfortunately, it's a federal legal requirement, and that is the landlord's tax information. There's no getting around that. If we're going to be providing a landlord with rental income, we have to notify the IRS. That's just a legal requirement. So again, when you're sitting down with someone and you're talking about this application, believe it or not, this is an expedited application compared to what sort of a regular emergency financial assistance application looks like. This is expedited, but it still has documentation requirements. And so you're totally right, Amy. It's about sitting down and setting those expectations of like, we're prepared to help you. We can help you relatively quickly, but these are some of the things that we require in order to provide you with this assistance. If someone calls and they're not prepared to necessarily give you their landlord's tax information, well, can we help you with a utility bill? We help you with the electric bill, the water bill, the gas bill, your cell phone bill? If they don't want to give you landlord information, you can still support them with those other expenses that they have.
This might be helpful. One thing to keep in mind is perhaps trying to have that communication with the landlord. If you just maybe get the contact information for the landlord, you could always talk to the landlord about them providing the tax information and social security number directly to you, because I feel like sometimes that might be a barrier where the landlord doesn't want to give that information to their tenant.
Right, that's a great conversation to have with someone, is their level of comfort in requesting the information from the landlord directly, or whether they give you authorization. The other thing is to demonstrate a real sensitivity to the disclosure of HIV status, right? Like this is an HIV affiliated program, but there's no reason why you need to say that, right? You just need to say it's COVID-19 assistance. And so someone may feel more comfortable with you being the individual who reaches out to the landlord. So with that, I am going to, hopefully everyone can see Joel's screen. He has CaseWorthy up and open, and he's going to walk us through the completion of the applications in CaseWorthy. Take it away, Joel.
All right, thanks. Can everyone hear me all right?
Yes.
Yep.
Hey,
All
Joel,
right.
is this going to be recorded,
Yes.
this section?
Yes, it's
Yes.
all of it's being recorded. Yep.
Oh, great. Thank you.
Mm-hmm.
No problem. Yeah, because we've only got like 20 minutes, so I'll try to make it quick. So there are a couple ways that you can access this. Right now, I am in the AFC programs admin role, but I do have the Hub call center dashboard pulled up. If you take an RCH call, you'll notice that there is a change to the workflow that branches off with the option to complete the EFA application. So that's the way that I'll go through this. It is also menued up for you where you can directly start the workflow here. It's kind of hard to sort of predict what the flow will be in terms of how and when you will actually go in to enter the application. So I tried to put it in a couple different places just so that depending on your circumstances, you can choose what's easiest for you, right? So I'm going to go ahead and start a call. And one thing I will say is that this is, this is a week turnaround for all of us in this process of putting this together. So, I think that there are things that we know will need to change and that we'll need to be flexible about. We just need to get that feedback. And so just keep in mind that, we're putting this together quickly and trying to get off the ground as soon as possible. So, I do foresee on the database side that there will be some hopefully minor kinks in the road, nothing major. But, especially you at COH have been so great about reaching out to me directly and addressing issues like really quickly. So as long as we keep that going, this is something that is a big priority for us and for me. And so if there are any issues that are preventing you from being able to do this, to complete the application, let me know. I'll just breeze through this stuff. I'll review for you all. So AFC folks, you will not see this. This is the call center stuff. And I'll tell you when we get to the part where the actual EFA application workflow starts. So I'm pulling in Joel test. So this is all the same stuff that you're used to, right? Like verifying the demographics.
And this is for a client
information.
who's already, is this for a client who's already in your system?
Yes, I mean you can do it'll do this. It starts. This is where it starts, right? So if you are entering a new client, you'll be able to enter all the demographic information and create a client record before you start the application. My only thought is that it probably won't be a new client, right? Because if you were waiting to complete the application until you've talked to them and they have their documents sent to you or ready to send to you, then you would already have had contact with them, right? So I think it's very rarely that you'd get a cold call and then start the application with them. Does that make sense?
I think that's true, probably, but I think that once information gets out, that people are going to re-enter or enter for the first time, maybe.
Yeah, totally. And the thing too is you can go through the entire application workflow and upload the documents later. It's just not going to get reviewed until all the documents are submitted, right? So you could start this and be like, okay, these are the things you need to get. It's just, I think whatever way makes the most sense for you all. So this was the question. It was like, do you want to complete the RCH screener, yes or no? Now it's, do you want to complete the screener or the COVID-19 EFA application? So this will take you to the screener as per usual. This will take you to the COVID-19 EFA application, and this will take you back to nothing like if you clicked the no before, right? So we'll click the COVID-19 EFA, and this is the first screen. It's just the demographic stuff. So if you've already just gone through that with them, you obviously don't need to again. And now it's going to create the application record, which is really an enrollment record for the EFA. So and then
Joel,
it'll start. Yeah, go
sorry,
ahead.
Joel, quick question. If you happen to make a mistake when you're entering information, is there any way you can go back and correct it or no?
No, you're screwed. It was a big adjustment for us. So I mean, there are ways, but it's like super roundabout. We can talk about it offline, and it just depends on where the mistake is. you know, in our old system, you could go back in a workflow and well, what we thought was making changes, but what really was happening was that it was creating duplicate records for each step. So it was a bummer to not have that here, but seeing what the alternative was, I think it's an issue we can live with. But yeah, if you make a mistake and you just reach out and I can walk you through how to update or correct the information.
Thanks.
Sure. All right. So this is the health insurance assessment, and what this does that's nice is it already pulls in their current insurance information, right? This is a fake client. They have 2 insurance records, that are both open, which they shouldn't. But so if they don't have any insurance record, if it's a new client or no one's ever entered insurance for them, the question will be, it'll look just like it is on the paper application where it says, do you currently have health insurance, right? And then you enter the information, but there's no sense in making you enter it if we already have information. So the question is this health insurance information still accurate, yes or no? If you say no, then it'll ask, do you currently have health insurance? If you say yes, then you enter the health insurance information, right? So,
Joe, I don't think the RCH screener has the option to input health insurance.
no, this is not the RCH screener.
Yeah, I know that, but I'm talking about.
Yeah. So what this is doing is that it's pulling in data from the entire system. So if there's an insurance record, if you write it in an existing client, you may already have an insurance record in the system, right? Now it could be old and it needs to be updated. Do that here, but otherwise, you should just ask if that's their current insurance, and if it is, then you can move on. So because, a lot of clients that call the hub are existing clients who are still engaged in different programs, and so are likely to have some relatively recent information. And the other issue too is that if you just, the way that we have the insurance set up, it's not like every time you do an insurance assessment, it's not going to create a new insurance record, right? So what it basically does is it saves a history of the client's insurance that applies to the client and not really do an assessment. So that way you're not asking the same questions over and over. They constantly have to keep answering the same questions about insurance. That's just like how we operate for our other things. And then do you have a primary care provider? This is going to pull in if they do have a primary care provider, it's going to pull it in here. But you still have to answer this. Yes. Have you visited your primary care provider in the last 6 months? And then if there isn't a record here, you can click Add New, and you'll be able to enter the new doctor information. Okay, so this is the HIV assessment, and what this is doing are a couple things. First, it's going to pull in any Ryan White or HOPWA enrollment that the client has ever been in, right? So this isn't really, not really fun, but so what this is good for is if there is a client who has been in Ryan White or in one of our HOPWA programs, that this will give you a flag. Okay, great. This is someone I could possibly reach out to AFC for to see if they have proof of damage, right? So it'll give you that information here. And the next thing it's going to do is it's going to pull in from the Ryan White record any information or any previous information entered about whether or not they have an HIV and or AIDS diagnosis, right? So this is already it's already pulled that in, so you don't even have to ask this again. You can just verify the date of HIV diagnosis, and then whether or not they have an AIDS diagnosis, And if they currently have a Ryan White case manager, if they do, have you seen your Ryan White case manager in the last 6 months? All right, so then for the temporary crisis situation, all you have to do is put in a brief narrative here saying what, in just, 2, 3, 4 sentences. It doesn't have to be long, but just really what the situation is that caused the crisis that's related to the COVID-19 outbreak, and what impact the assistance will have moving forward. So really just those 2 points are all that you need to hit, right? What's the situation related to the COVID-19 outbreak, and how will this help them sort of maintain stability, financial stability, right? That's it. Okay, now this is something where I think that, this is symptomatic of the fact that we are doing this quickly, and I had walked away from the last time planning conversation with this under the impression that we were going to allow for verbal consent for release, so that when you are on the phone with them, you don't have to somehow send them a document to sign and have them somehow print it and whatever and send it back. So this is set up to be a verbal consent. So Roman and others, if this has to change, let me know. But right now, what this is you basically would read this, it's blah, 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 I certify the information is correct, I consent in connection with my enrollment, blah, blah, blah. And then you would add your signature. So this is just affirming that they verbal consent. I'm on my laptop with a mouse. And so I just drag that with my mouse on that little pad. So you don't have to have a touch screen or anything like that. You can do it.
So I will send out communication to everyone regarding this. I think this is the fact that we were able to build this out, and thank you so much, Joel, so quickly, really sort of demonstrates the flexibility, right, that we're trying to have with getting this going. So I'll send out clarifying information. I think if we can accept this, I think that would be a great way to prevent having to get client physical signatures and stuff on documents. So I'll send out clarifying information.
Great, thanks. And the other thing too, we had tossed around the idea of, for the client rights and responsibilities and grievance policy, just making it an option to email it to clients if they want, but not necessarily needing to have their signature, just for this process in particular, just given that it's very unlikely that a lot of these clients are going to have a printer and be able to print these out and then sign it and scan it and send it back, right? So
Yeah. Or is there an option perhaps, I don't know how difficult it is to build it into the system, but would it be possible to build it in similarly for the RRG?
yes, like this.
Yeah.
Yeah, it just would be a lot to read. You know what I mean? It's like really long.
It would, however, just considering the fact that, like, as you mentioned, not every client would have access to printers, it would, as much as it does sound like it would make it for a longer phone call, it would actually expedite the overall amount of time to process this, because versus having to wait a couple days for them to get in the mail, or a few hours, or even a day for them to respond to an email, this might take an extra 5-10 minutes to read, but then you have all the consents you need.
Yeah, I don't believe that the rights, responsibilities, and grievance signature is a funder requirement, and so that's where I'm not sure that we need a signature for that, right? So the idea was we could potentially email. Yes.
Sorry, this is Scott.
Hey, Scott.
Right now, the grievance form, there's 2 separate forms. There's a grievance and there's rights and responsibilities. Neither of those currently have a signature block on them.
Gotcha.
We were going to collect the signature separately. So one option would be to just, in this form, just simply say, I have received the rights and responsibilities form and the grievance procedures.
Perfect.
So you don't have to put all the text in it. They'll have that sent to them for their keeping.
Right. Perfect.
Cool.
All right.
So just so
Can you see
everyone,
my screen still?
yeah,
Yes.
Okay. It says,
It looks frozen though.
oh shoot. Damn it. I'm trying to. Mhm. All right, I messed up. So I was trying to get rid of let me just run through this real quick.
Ramon, for the RRG, or I guess whoever knows the answer to this, are we not going to collect that signature until they've received that in the mail?
you would, if
Well, I
you
guess
want to,
we would not sign it ourselves saying they have verbal consent until they've received that document.
until they've been able to see that document, right? So it would either be in the mail or it would be you've emailed them the document and you've confirmed that they received the email.
In regards to us being able to go back into the screener, like once we've completed their application without the signature that we required, we acquired their verbal consent, are we allowed to go back into the screener to edit that and include the signature later?
Yes.
Okay.
So Joel, are you frozen? Did your internet crap out?
No, can you not see my screen?
I don't see your screen. Can anyone else see Joel's screen?
No.
Nope, it went away.
It's gone. Do you want to kick it? Oh, there you are. You're back.
Oh, there it is.
Okay. All right, I got some messed up stuff happened, so I'm just.
Oh my God, Joel, is that your dog?
No. Nah. Okay, I know we are like 30 seconds to time. If you could bear with me for just 10 minutes, maybe, I'll be able to get through this. Okay, so this is where you'll start documenting the services they're requesting, right? And so one thing that's annoying is, so you're creating an Efa application, that part's done. Now you're making the request for everything that they're requesting, right? And so everything that they're requesting has to be a separate request. It's not hard to do. It's just a little bit time consuming, but it has to be like that for the way that the supporting documents have to be and for the way that the payments have to be processed, right? So I'll just go through just a couple examples here, right? So the one thing that's super easy, right, is that, and that requires very little documentation, is the $200 gift card, right, for emergency food and basic needs assistance. And you don't even have to enter anything at all. Just you select that, everything else is there. It shows $200. You click save. And so you see that here, right? So this is the request summary form. There's a little blurb here that just explains what to do. If you want to add another request, let's say they're like, yes, I want the $200 gift card thing, and I also need help with utilities and rent, right? So we'll add a new request. And the other thing too is if it's, let's say they want utilities they're like, I need to pay people's gas and I need to pay ComEd. Those would be two separate requests, right? Because they're two separate payments to separate entities, right, to separate payees. So I'm going to choose emergency utilities assistance, and you will have to say, so you'll have to put the amount, let's say it's like $60, and the months that the payments will cover. So just to cover March. And then this is where you'll look up who the payee is, right? So who's going to be paid. So this is going to search for, depending on the type of provider or payee, this search form will be sort of based on that, right? So you can enter part of the name. So let's say it's People's Gas, that's the only one that started with PEO, so that's why it pulled it in. If you go back.
So question on that, Joel. If this is,
Yeah.
say, a property management company, and they're found in there, would that mean that we don't need their EIN letter in that information?
So here, that's a great question, Rudy. Let me finish this part and then I'll do that. I'll run through that one, so that you can see. Yeah. So, we don't have a ton of payees in here, so it's possible, especially because it could be like for Comcast or something like that, right? That it's not, or T-Mobile. So you could add a new one. You would just put the name, the phone number if you have it, the address, and then click save, and then it'll pull it into your form, right? So I'm going to choose People's Gas, and then for utilities assistance, you do have to put the client's account number, right? Because we have processing to know, they have to send that information with the payment. So.
Can I ask that anyone who isn't currently Joel, please mute your line? Thank you.
All right, and then I'm going to add rent payment. Let's say it's $1,000. So this is where to look up, and there are, I think, close to 700 landlords in here. If I just click search without anything, you can see like there's quite a few. What I'm working on, and hopefully we'll have it today, is I have the query written out to update this, but any of those that we already do have in here, I did get the okay from our finance that if it's one of these that we imported, then, and we have the EIN, the EIN number, that means that they have a copy of the EIN letter, so you won't need that. And so it will write, what I'm working on today is I'll send that, and then basically that checklist for that landlord, that EIN letter will already be checked as completed. So you won't have to get that. And you'll see that when we get to the documents part. But hopefully by the end of the day today, it'll be like that. So I'm just going to choose, I'm going to look for, it's very likely that your landlord, the client's landlord, won't be in here. So you can just add a new landlord here as well. And of course, you will obviously need to get the required documentation for that too. The one thing that I did want to point out, when you create a new landlord and it pulls into this form, the tax type, corporation, partnership, or individual, that is, you'll see that on the W-9 form that you get. That's required documentation, right? So that's where you'll see that. There's like the check. Those are the three options on the W-9. So you'll just be able to do that there, and the EIN number will be on that as well. Right? So, all right. So okay, so we have our things here.
Hey, Joel,
Yes.
Is the EIN number the payee ID on that previous screen?
No, the payee ID is the CaseWorthy provider ID number. That just pulls in, it needs to be in order for it to know when you're attaching the landlord documents to attach it to that landlord, right? Based on that CaseWorthy number. So you don't have to like look at that at all. Here, I'll go back in here so you can see it again.
Don't mean to interrupt, but I can email out a copy of what a sample EIN letter looks like if anyone wants it.
That would be awesome. Thank you.
No problem.
And if you do need samples of other things, just you know, Alma and her team have been doing this for years, so they have lots and lots of examples of documentation and stuff like that. So if there are things that you need, or if you have any questions about documentation, feel free to reach out to AFC. So yeah, so Jill, to answer your question, so see, that number means nothing to you, and it shouldn't, but it needs to be on here just to make sure that we're getting that in. But the EIN number is here.
I see it, thank you.
Yeah, and so then the other thing is that if it's an individual, you would get the social security number, right? Not the EIN, right? And that's why, you know, as Roman talked about, for landlords who are individual landlords and don't have an EIN, that's why you need a legible copy of the social security card. Oh, I didn't want to do that. Okay.
Just a quick question.
Yeah, go ahead.
We're not allowed to pay any bills that they've already paid. It can only be like outstanding bills, correct?
That is
correct.
Payments can't be made. I'm sorry, go ahead, Joel.
Oh, we were probably going to say the same thing. I was just going to say we can't legally pay money directly to the client. So that's why, you know, that's like all of these, it gets paid to it has to be to a payee other than the client. And then the $200 gift card, that's the closest that we can come with this to actually providing cash to the client.
Okay.
Yeah. So I didn't actually want to create this one. And if you make a mistake, you do have the option to delete. So I'm just going to go ahead and delete that because I don't want it. And then, so if you make a mistake, you can delete it here and then just add a request and put one in. All right. So once you're happy, you've got all your requests in. It will take you to the
Slower, Joel, slower.
This document summary form. It's a bit of a mess. At some point, I'll try to make it prettier, but at this point, this is sort of, at least you have all the information for these on one page, right? So the reason it has to be like this is because there are some documents that are tied to the client specifically, right? And so if it's a client that we already have the state issued photo ID copies for, you won't have to get it again. If it, or sort of the proof of status, those sorts of things, right? If once it's in here, we just don't have a lot in here yet because it's a new system. Once it's in here, you won't have to have it again. But the only way to make that happen is if we have tied these just to the client, right? And then these have to be tied just to the application itself. And then this didn't update, and it should have. I'll check into that. This should automatically, once you complete the Efa application, it should automatically create the record for you. I think when I was going through with the test, going through quickly after messing it up, I messed that up. But I'll go back and check to make sure. So this should already be completed. And then some things are tied to the landlord. So you'll see if it's a rent payment where you have to enter landlord documents, you'll have the landlord document button here. And then for the services, that's what these are for here. So I'll just click on the client one here. This is a quick fix, but it's not pulling the parameter in. So I'll fix that. But I'm trying to think of what this is. This is what it should look like. And it is actually showing that it has that. But so let's say you needed to upload. So you obviously only need, if it's a client living with HIV, you only need this. If it's a client who's vulnerable and on PrEP, you would only need this, right? So you don't need both. But there's no easy way to say, well, you only need the one thing, right? So, but to upload a file, you would just click that little upload button and then find your document. It's going to do that again. Sorry. So now it's showing that it's submitted and acceptance pending, right? So then once the review team here reviews it, then they will, this will change to either rejected with a reason or accepted. All right, and then for the landlord documents, the same deal, right? So this is going to pull in, because it knows this is a corporation and not an individual, it's going to ask for the EIN and the landlord W-9, right? And then for the service documents, this is the rent one. So it's going to ask you for the current lease, rent, mortgage statement. Same deal, just click this, upload the file, and save it. And then this is the utilities one, so it's going to ask for the utilities bill, right? It says past due, just know that you can put any utility, current or past due utility bill. It's just, that's the document type that's used for the EFA. So, okay, so that's how you would upload all of the documents. And then once you're done, you're happy, go ahead and click done. If you didn't get all your documents in, you can go back and do that. I'll show you how to do that. So that's it. And then if you go back to the call center, there's this here, Efa Applications. This is user specific, right? So this will be just for, this will just show me the applications that I have, right? So these are the two requests that I just created, right? You see it's the same application ID. So it's the same application, but these are the two requests. And if you click here and you go to view document checklists, it'll take you back to this and you can upload any documents that you didn't get a chance to before, right? Then you can always come back here to check the status to see when it was reviewed, who the reviewer is. I'll be building out more around this. It's just, we don't really know what it's going to look like in terms of what data it's going to get pushed out with the review because we haven't done any reviews yet and approvals. So more to come on that, but at least it will give you the updates on the status of the application. But you will receive an email in terms of when there's an update to the status, and if you do need to submit any additional documents or resubmit documents, you will receive notification of that.
Roman, are we allowed to have landlords email us directly with these documents, or do they have to go through like Center on Halstead's official email?
Everything, my understanding is everything should be every communication should be going through the Center on Halstead's email.
Okay.
Right. I would, yeah. I can say for the AIDS Foundation of Chicago, our HIPAA policies forbid us from using any of our personal accounts for any communication. So if you're receiving any landlord information, it should all be through your Center on Halstead accounts. The reason for the text specifically with clients is because that's PHI. It's protected health information, and so that needs to have a stricter level of security. But landlord stuff can go to your, and should go to your work email accounts.
Jill, is that right? Can we use our Center on Halstead personal emails, or do we have to go through the Center on Halstead's like singular email address?
So
No, you
it's a
will
good,
use.
I was
Yeah.
just going to say there are two issues, right? The first one is sort of like the confidentiality and legality issue. If a landlord is voluntarily sending you information about them as the landlord, that's not, there are no legal issues with that, right? There's no PHI that's being exchanged, even if there was. The landlord is sending information to you, so legally you can receive it in your email. The only problem is, so that's the legal side. The other part is sort of like the logistics. The problem of it going to your inbox is, let's say you're sick or something like that, or there could be a situation where a client or the landlord's like, well, I sent them that and they never, whatever. And because it's in your inbox and no one else has access to that, there's no way to track and verify and say, no, like actually we didn't receive this or whatever, right? So there's like that logistics part of it too. So, I mean, a lot to consider for the landlord stuff. I think it makes the most sense to have one standard place procedure that everything goes to, but I think that's sort of up to you all.
Yeah, I mean, I can tell you for AFC, staff are receiving it at their individual email accounts. So Jamaica will be receiving landlord documents at jhicks@hchicago.org.
And at this point, that's what we would do. It would go, so it's your personal Center on Halstead email, not your Gmail or something.
Right.
It's going to the Center on Halstead, unless we can figure out which, maybe Jim, our IT chief, can create another email box for folks, and then you could go in and grab that, and you would get an email. Everybody on the team would get the email, so it's still going into your personal email box because you get an email saying you got here's your email. So kind of weird, but
right.
But at this point, yes, use your but make sure it's Center on Halstead and not any personal. So if you're doing it from your phone, make sure it's defaulting to Center on Halstead.
And the thing to keep in mind as well is that, right, this is the work of the rapid response team, right? Like, you're going to be working with individuals, completing these applications, submitting them, communicating back to them about the disposition on the application. So, this is sort of the beginning of that work of setting expectations, of clarifying for individuals what the process is going to look like and how it's going to be. And so to the extent that you're developing your relationships both with the clients and then with the people that you need to collect documentation with, I think this is sort of the beginning of that work. So I encourage you to sort of be as proactive as possible in doing that. Joel, any final words? I want to acknowledge the fact that we've gone 20 minutes over time, and I want to be respectful of folks' time. Any final things that you need to show in CaseWorthy before we sign off?
No, that's the basic rundown. Like I said, if you run into issues, let me know right away, and I'll get on it right away. And if you have any questions, feel free to reach out. And like I said, as Roman pointed out, this is something that is emerging, and so we do have some flexibility in making sort of procedural changes as this unfolds.
And the important thing is communication and feedback, right? Is letting us know. Although the feedback telling us that receiving the landlord information or getting the landlord information is a barrier, we know that. But still, I think any feedback on the implementation of this application is welcome. The other thing I just want to point out really, really quickly is we've already made the change to the consent form. Can you, whoever that is, can you mute yourself real quick, please? Okay, just want to let people know that the changes have been made to the consent form that includes that the electronic consent is going to cover both the client's rights and responsibilities and the grievance procedure. So those are still forms that are going to be notices that you'll have to email or mail to the client when they're applying, but the consent for them or the acknowledgement of them is now folded into the consent. I will be creating a folder of shared documents just so that we all have the latest versions of everything, and I'll be sharing that link so that everyone can access that in a shared folder. So look for that to that link and all of the documents to be included in that shared folder later this afternoon. With that, I will
We
thank
put the recording in there too.
I'll see if the recording will be able to. It's probably going to be a really big recording. So usually our default is that we upload the recording to our YouTube account, and then I send out the YouTube link to individuals to view the recording. So if I can fit it in there, I will. I suspect it's going to be too large and I'm going to have to send out a link, but I'll send out a link and it'll come out within a day or two.
Okay.
Cool. So again, thank you everyone for registering, for participating, for downloading the documents. I will hopefully stay in communication with everyone. Again, communication is going to be the key. Let us know what's working, what's not working, and any feedback that you hear from participants trying to access this assistance is truly, truly welcome. So let's go out there and help some folks, okay? Thank you all so much, and I will talk to you all later.
Thanks.
Thanks, Roman.
Bye.
Bye.
Thanks, Roman.
Take care.